Good afternoon. My name is Mike Abbatiello. I'm the Chief Financial Officer for Heywood Healthcare. Today is Friday, November 20th, and I'm giving the COVID-19 and weekly update. In regards to our testing, we have tested nearly 34,231 specimens with 32,986 negative results. This means we have 818 positive results and 108 indeterminate results. Cumulatively, we have a positive rate right now of 2.4%. This compares to a statewide average of about 2.5%, so a little bit lower than our state average. However, our 7-day average percent positive is 3.25% versus a state rate of 3.17%. So actually, over the last 7 days, a little bit higher than the statewide average. You'll see that in a second when I go through some of the community data. Statewide statistics. Right now, overall, state of Massachusetts has about 7.6 million specimens that have been tested. That has a 7-day testing rate of about 923 per 100,000 residents. And then the number of viruses that were detected is 192,000, which results in a 7-day case rate of about 29.4 per 100,000 tests detected. We have a percent positive of 2.5% cumulatively as a state, and the statewide average right now for 7-day is 3.17%. We have 10,435 deaths right now in the state of Massachusetts, which are 5.4% of confirmed cases. Worcester County is about 21,632 cases, and 1,228 of those resulted in deaths. And in Franklin County, we've had 565 cases, and 75 of those resulted in unfortunate deaths. So if you look at some of the community data, we are showing some signs of increased incidence in some of the communities that we're in and serve. If you look at Ashburnham right now, that's currently in code yellow. Athol's currently in code yellow. Gardner is also with a 4.43% 14-day percent positive rate. Right now, Templeton's in code red. We have Westminster's in code yellow, and Winchendon's in code red. Right now, the state of Massachusetts is in code yellow. Worcester County's in yellow, although Franklin County's in code green. We highlight this for you for your awareness. So if you're in these communities, please make sure you're being safe, that you've got your masks on, that you're keeping your distance, and just want to make sure you're aware of the instances of COVID in our communities. Currently in-house at Heywood, we have one COVID positive patient in our ICU, and we have one patient in our Watkins 1 unit. We have some positive news in the healthcare system. Yesterday was National Rural Health Day. We're very proud to say that we have one of our employees was awarded the Community Star for Massachusetts, Maureen Donovan. Maureen leads our telebehavioral counseling program in rural high schools, both in the North Quabbin as well as the North Central region areas. The tele team has completed over 4,000 clinical sessions and worked with 200 students in our partner schools. You can read about Maureen's recognition here. We want to especially give a congratulations to both Maureen and her team with a great accomplishment for our area. So if you see Maureen or someone from the telebehavioral program, give them a virtual fist pump and congratulate them for their great work. Some announcements and some reminders. Employee flu vaccinations or flu shots. They're actually going to be administered today. So 2 times, both between 5:30 and 8, and then between 10 p.m. and 1 a.m. That's in the OBS conference room right outside of maternity on the first floor. Just a reminder for employees that all flu vaccines need to be received according to the policy by December the 6th. So that's coming up shortly. If you have your flu vaccine administered at another location, that will be okay. Just please make sure you get your form of either administration or declination to Employee Health. If you've not been able to attend one of these times that flu vaccines have been available at Heywood or Athol, we are aware that the local CVS pharmacy has plenty of availability, so please make sure you get there. Governor Baker has issued a mask order effective November the 6th. That order requires face masks or cloth face coverings in all public places, even when they are able to maintain 6 feet of distance from others. A reminder that visitors will be provided with a surgical mask upon arrival. Just another quick reminder at Heywood Hospital, the north parking lot, starting today and into the weekend, the north parking lot will be blocked off for repairs and paving. Please do not park in the blocked off areas as we work to finish this project in a timely manner. We wanted to just give you a quick update on the most common U.S. passwords to avoid. So an email from Carol Rosa, our CIO, was sent out earlier this week detailing some common passwords to avoid, whether at home or at work. Please ensure your passwords are private and protected. The Boys and Girls Club auction. The Boys and Girls Club of Leominster and Fitchburg is holding a virtual auction to support the Gardner Clubhouse. The fundraiser runs through Monday night, and you can register by clicking the link here. Please support the youth in our area through this fundraiser, very important. Holiday season update as we head into Thanksgiving week it is important that your celebrations follow the guidelines put in place by the CDC and the Massachusetts DPH, as well as your local city or town. We continue to offer drive-up COVID-19 testing at our Heywood Hospital campus. You must have an appointment, and you can visit www.heywood.org/COVID-19 testing for more information. There are some other links here that you certainly want to take a look at that are important as well. I encourage you to sign up to receive these emails if you've not done already. The link can be found at this post. And please remember to wear your mask, wash your hands, stay socially distant, and be kind. This is a very difficult time for all of us, and anytime you could make sure that you're doing that, we certainly would appreciate it. I'm going to now turn this over to Andy Patterson, our VP of Ambulatory Care and Executive Director of our Heywood Medical Group, who will provide information regarding the use of telehealth services. We thank you very much. Have a happy and healthy Thanksgiving. Enjoy your time and be safe.
Hi everybody, I'm Andy Patterson. I'm the Executive Director of the Heywood Medical Group and the Vice President for Ambulatory Services at Heywood Healthcare. I'd like to talk to you about our Safe Care Here commitment and telemedicine. So when we talk about Safe Care Here, we think of things like using masks and door screening and maintaining socially distanced spaces. But that's not the only way that we can provide safe care at Heywood Healthcare. We can offer alternative solutions, and that is the use of telemedicine. So if you remain concerned about coming to your physician or advanced practitioner's appointment and you want an alternative to being in person with them, telemedicine is a wonderful alternative. So telemedicine is an appointment with your provider, and it's done on a computer, a tablet, a smartphone, and in some instances even your telephone. The provider will ask your same typical questions. They will seek to understand what is happening with you in that moment and be able to discuss their assessment and care plan with you, and even discuss treatment options, just like they would in an in-person office visit. At the conclusion of the visit, the provider will obviously take care of any prescriptions that you might need, and then they will document the visit, not unsimilar to an in-person visit. While not all matters can be addressed through a telemedicine visit, so many can. And we've learned more and more how to be flexible with our treatment options and to address them through telemedicine. When they can't be assessed through a telemedicine visit, you can be assured that we take extra precautions here at Heywood to make sure that your care is safe and that you will remain well. Thank you very much, everyone, and to schedule a telemedicine visit, please reach out to your physician or advanced practitioner's office, and they would be happy to schedule an appointment for you or one of your loved ones. Thank you. Have a great day, and be well.